One of the major advantages both lawyers and plaintiffs have in the Stryker litigation over lawyers that have handled other hip litigations is that we've gone to school a little bit on learning how these failed metal hip implants affect people, and the doctors and the science and the technology for looking at how these people are hurt has developed substantially even over the past 4 or 5 years. So in today's date, we have far more tools available to us as lawyers trying to prove up the client's case than we had just a few years ago. I was fortunate enough to actually have a state court bellwether Depew ASR case set for trial. As a result of that, I had to go through the entire litigation process with the experts, expert depositions. We had to look at tissue. We had to have the device looked at and analyzed. And as a result of having been through that process, I am so much more prepared and sophisticated in my thinking about the damages in these cases now that I'm going to really be able to do a good job for these people in the Stryker case. What we've learned is that the magic of the damages for these plaintiffs is in the tissue. Complete change in our thinking from when we started into, say, the Zimmer-Durham Cup or in the Depew ASR or Pinnacle failure cases, where all the focus was on the device. We looked so hard at the device, we got myopic, and we wanted to prove that the device was bad, and we didn't pay really enough attention to, okay, yeah, the device is bad. They admit that. They took it off the market. What does it cause, and how does it cause it? And what are the long-term effects of this device failure in any individual patient? Well, there's a couple of things. I'll just throw this out there. In looking at the tissue, there are things that you can do that will actually allow you at like the cellular level to look at the metal in the tissue. It's actually fascinating. You can use inductively coupled plasma spectrometry. Lots of fancy words. But you basically take an electron microscope and you look at the cellular level, and that microscope and that technology has the ability to identify what metal is in the cells that you're looking at. It's fascinating. The other thing we can do is we can do what's called X-ray diffraction technique on pieces of tissue that are removed from the patient at the time of the revision surgery. And it'll actually light up the metal in the tissues and tell you exactly what the metal is. It identifies the constituent metals that are in the tissue. That's something we really weren't doing at the beginning of the Depew ASR cases. And it's become very, very, very fascinating. In addition, everybody's been focused over the past couple of years on chromium and cobalt. That's it. That's what the device is made out of. And when the patient finds out that the device has been recalled, their doctor draws their blood and looks for chromium and cobalt levels. Well, we got, again, a little myopic in some of the previous litigations, and all we did was look at chromium and cobalt in the blood. We're doing so much more now. We're actually, when people have biopsies, we're actually capturing that tissue and having the tissue, I'm talking about biopsies not of the hip, but of the breast, the kidneys, the liver, the spleen, the prostate. We're capturing that tissue and looking at it, and sure enough, in at least 1 or 2 occasions so far, we found metal in tissue in organs remote from the hip. In prior litigations, what we have focused on is the destruction of tissue around the hip by the metal. Well, what's amazing though is we also knew, but didn't fully investigate, what these metal ions are doing when they're circulating in the blood. We do know for a fact, because of prior research, that these ions are small enough when they're in the blood, they can actually cross the placental barrier. So for a woman of childbearing years ago, it was a contraindication to have a metal on metal hip put in you if you were a woman of childbearing years, because if the device failed, these ions can cross into the fetus. It also crosses, the metals in the blood also cross the blood-brain barrier. So you can actually get circulating chromium and cobalt in your brain. If it gets into your brain, it can get into a fetus. It's getting into your kidneys, your liver, your spleen, your breasts, your prostate, your lymphatic system. And so if you look back 50 years, the biggest concern I have for patients that have been subjected to a heavy metal burden in their blood, evidence clearly exists that this increases a patient's risk of developing all different kinds of cancers. Cancers at the site where the implant is, hematopoietic cancers, bone marrow cancers, lymphatic system cancers, and end organ cancers, cancers of the kidney, the liver, the spleen. And so it's super concerning to us, and we're paying a lot of very close attention to that in this case, because these devices were designed and marketed to be put in very young people. So my youngest patient is 34 years old in this litigation. And that 34-year-old she's actually got two of them. She's a bilateral. That 34-year-old with bilateral failed implants has been subjected to a fairly significant metal burden that's been circulating in her blood for some time. I'm really worried about the future for that patient because she's not 70, she's 30. So the latency period for exposure to toxins and the causation of various types of cancers can be a very long time. So I'm much less concerned about somebody that's 75 that's had this happen than I am for somebody, say, that's 34.